తలనొప్పి, నరాల బలహీనత, మూర్ఛ వ్యాధి, పక్షవాతం, బ్రెయిన్ స్ట్రోక్, బ్రెయిన్ ట్యూమర్స్, మెడ, వెన్నెముక సమస్యలు, పక్షవాత సమస్యలకు పరిపూర్ణ వైద్యం డాక్టర్ రావ్స్ హాస్పిటల్స్, గుంటూరు. మన దేశంలో మరెక్కడా లేని ఆపరేషన్ థియేటర్, అడ్వాన్స్డ్ ఎక్విప్మెంట్, అమెరికన్ టెక్నాలజీస్ అండ్ టెక్నిక్స్. న్యూరో సమస్య ఏదైనా డాక్టర్ రావ్స్ హాస్పిటల్, గుంటూరు. రండి, చిరునవ్వుతో వెళ్ళండి. 90-100-56444, 90-100-57444.
Stroke, an overview. A stroke is a severe medical condition that occurs when the blood supply to the brain is disrupted, leading to the damage or death of brain cells. It is vital to understand the definition of stroke, its impact on the brain, and the different types of stroke. Definition of stroke. A stroke, also known as a cerebrovascular accident, CVA, occurs when the blood flow to a part of the brain is interrupted or reduced. This interruption can be caused by a blood clot, ischemic stroke, or bleeding from a ruptured blood vessel, hemorrhagic stroke. Brain cells begin to die within minutes when the brain does not receive enough oxygen and nutrients due to disrupted blood flow. Types of stroke. There are three main types of stroke: ischemic stroke, hemorrhagic stroke, and transient ischemic attack, TIA. Understanding the differences between these types is crucial for effective diagnosis and treatment. Ischemic stroke. Ischemic stroke is the most common stroke, accounting for about 85% of all cases. It occurs when a blood clot or plaque buildup blocks a blood vessel supplying the brain. As a result, the affected brain area is deprived of oxygen and nutrients, leading to cell damage. Ischemic stroke can be further categorized into thrombotic stroke and embolic stroke. Thrombotic stroke. This type of ischemic stroke occurs when a blood clot forms within one of the brain's arteries. It often develops in areas where the arteries have been narrowed or damaged by atherosclerosis, a condition characterized by the buildup of fatty deposits. Embolic stroke. An embolic stroke occurs when a blood clot or other debris forms elsewhere in the body, usually in the heart or neck, and travels to the brain, blocking a blood vessel. The clot or debris is called an embolus. Hemorrhagic stroke. Hemorrhagic stroke accounts for approximately 15% of all stroke cases and occurs when a blood vessel in the brain ruptures, causing bleeding into the surrounding brain tissue. The two main types of hemorrhagic stroke are intracerebral hemorrhage and subarachnoid hemorrhage. Intracerebral hemorrhage. This type of hemorrhagic stroke occurs when a blood vessel within the brain ruptures, leading to bleeding within the brain tissue. It is often caused by high blood pressure, trauma, or an abnormal blood vessel rupture. Subarachnoid hemorrhage. Subarachnoid hemorrhage occurs when there is bleeding in the space between the brain and the thin tissues covering the brain, called the subarachnoid space. The rupture of a cerebral aneurysm, a bulging or weakened area in the wall of a blood vessel, commonly causes it. Transient ischemic attack, TIA. A transient ischemic attack, often called a mini-stroke, is a temporary disruption of blood flow to the brain. It is similar to an ischemic stroke but resolves quickly, typically within 24 hours. TIAs should never be ignored, as they can serve as warning signs for a more severe stroke in the future. Understanding the differences between ischemic, hemorrhagic, and transient ischemic attacks is crucial for prompt recognition, accurate diagnosis, and appropriate treatment. Each type requires specific management strategies to minimize damage, prevent recurrence, and optimize recovery. In the following sections, we will delve deeper into the causes, risk factors, diagnosis, acute management, prevention strategies, and living with stroke, highlighting the expertise of Dr. Rao, a renowned stroke specialist. Thanks for watching.